Welcome to this explainer, everyone. Today, we're unpacking a massive and frankly fascinating shift happening right now in the global food landscape. It's a shift that literally connects the farm where your food is grown directly to the medicine cabinet in your home. For a long time, the global food trade, especially when we talk about animal products, has been governed by this messy, complex web of different national standards. But right now, a major catalyst is forcing the entire world to get on the exact same page regarding one absolutely crucial issue: the use of antimicrobials and antibiotics in the animals we eat. So let's dive into it. I want to kick things off with a pretty stark question. Why are life-saving human medicines ending up in our food? It's a wild thought, right? But it really challenges us to think about the hidden cost of how our food is traditionally grown. For decades, antibiotics haven't just been used to treat sick animals. Actually, they've been used routinely to compensate for poor hygiene, high animal density, or just to get animals to grow faster and yield more. But as we're going to see, this practice has a severe consequence, and it's triggering international alarm bells. So to understand how the world is responding, here's our roadmap for this explainer. We're looking at Section 1, the global food trade shift, Section 2, the silent AMR pandemic, Section 3, impact on everyday foods, Section 4, India's regulatory awakening, Section 5, farming without antibiotics, and finally, Section 6, the future of food. All right, starting with Section 1, the global food trade shift, the ticking clock. You might want to circle September 3rd, 2026 on your calendars. The European Union has put into motion what are known as mirror measures under their Veterinary Medicinal Products Regulation. Basically, what this means is that third countries exporting animal products to the EU now have to prove they have equivalent controls in place. They have to outright ban the use of antimicrobials for growth promotion, and they absolutely must reserve certain critical antimicrobials exclusively for treating humans. If exporting countries, say India, Indonesia, or Australia, can't provide sufficient evidence of this, they get left off the EU's authorized list. And if you're not on that list by September 2026, your products are banned entirely. No way around it. It's a hard deadline, and it is sending shockwaves across the global agricultural sector. Which brings us to Section 2, the silent AMR pandemic, the hidden threat. Let's look at the actual reason behind this EU crackdown. This is all about antimicrobial resistance, or AMR. You've probably heard of it. It's a phenomenon where bacteria evolve to resist the very medications designed to kill them. Now, when farms rely heavily on antibiotics just to compensate for dirty or cramped living conditions, they're essentially building a training ground for superbugs. These resistant bacteria can then just travel right through the food chain, straight onto your dinner plate. And the primary danger, when we consume these residues or encounter these bacteria, the life-saving medicines we humans rely on, they just stop working. In fact, one of the sources we looked at calls this, quote, a silent pandemic, and that hits the nail on the head. We, as a global population, literally cannot afford the health burden of our most critical medicines becoming useless. This isn't just bureaucratic red tape. It is a desperate fight to protect public health. Fixing the food supply chain, that's step one. Moving on to Section 3, impact on everyday foods, the ripple effect. So how are these high-level global regulations actually changing the food sitting right in your kitchen? Well, it's a remarkably widespread issue. Take aquaculture, for example. Countries exporting shrimp and fish are facing the very real risk of total import bans if they don't get on that EU authorized list. Then there's honey. Believe it or not, the EU frequently rejects honey shipments because tests reveal unauthorized antibiotics like chloramphenicol. They have strict reference points for action, so if a lab detects it, boom, the honey is rejected. And dairy. Under these new rules, dairy farms as far away as Australia have to keep rigorous, auditable records of every single veterinary product used. They have to prove on paper that they're treating disease, not just artificially boosting their milk yield. And you better believe this intense scrutiny applies to the meat we eat too. Processed and packaged foods, whether it's beef, poultry, or pork, face incredibly strict residue monitoring. To keep global trade flowing, major exporting nations are running vast national sampling plans. Regulatory authorities in places like the US and Brazil, for instance, are doing continuous volume-based testing to monitor veterinary drug residues. They have to use hard data to verify that there are absolutely zero growth-promoting antibiotics in the final product. Let's shift gears to Section 4. India's regulatory awakening, the local action. It's fascinating to see how global pressures force radical local action, and India is a perfect case study. Historically, India would often create strict standards just for the food it exported, while domestic rules kind of lagged behind. Like back in 2010, they found antibiotics in honey, and they just issued a basic advisory. But look at the recent acceleration here. In 2019, the government boldly banned colistin, which is a last resort human antibiotic, in all food-producing animals. Fast forward to October 2024, the FSSI published a massive, comprehensive list of antibiotics banned at any production stage for meat, milk, poultry, and fish. By May 2025, the Health Ministry formalized a major ban. And because they put these strict internal guarantees in place, by May 2026, the EU drafted India back onto their approved export list. So external export pressure actually ended up fundamentally upgrading the safety of food sold locally to Indian citizens. That's a huge win. And I really want to highlight this specific number from that recent framework: 34 out of 37. The Union Health Ministry banned the veterinary use of 34 out of the 37 antibiotics that the EU classifies as absolutely critical for humans. The government explicitly stated that there are safer alternatives available for treating animals, meaning we don't have to sacrifice our human medicines just to keep farms running anymore. So, Section 5, Farming Without Antibiotics, the Way Forward. If we take away these drugs, how exactly do we grow food? Well, it requires a complete paradigm shift on the farm. The old methodology, very reactive, very chemical heavy. It was all about using drugs as a crutch for bad farm hygiene or cramming way too many animals into tiny spaces. But the new methodology is all about preventative management. Farmers are now being encouraged and legally pushed to improve breeding conditions, boost biosecurity, and just keep cleaner environments so the animals don't get sick in the first place. And we are seeing some amazing localized solutions popping up. In India, the National Dairy Development Board has been doing incredible work promoting ethnomedicine. Basically, they're using traditional, indigenous herbal practices and remedies to manage animal health. And this isn't just theoretical stuff. They've successfully proven that farmers can drastically cut down their reliance on modern antibiotics while keeping their herds super healthy and highly productive. It's this awesome blend of ancient wisdom solving a very modern crisis. Let's bring it all home with Section 6, the future of food, ensuring safety and trade. To sum up the massive structural shifts we're witnessing, going forward, international borders are acting as a very strict filter. Every single shipment is increasingly going to require official health certificates signed by national authorities, proving no illegal antimicrobials were used. Countries are continuously testing foods against really strict maximum residue limits, or MRLs. We're also seeing the rise of split production systems in places like Brazil and China, where specific, highly monitored farms are ring-fenced exclusively just to meet these strict EU standards. But most importantly, the entire global supply chain is fundamentally transitioning away from just treating sickness and moving towards preventative animal health care. So I'll leave you with this final, provocative thought. Next time you sit down and look at your plate, ask yourself, is your food growing at the expense of your medicine? Thanks to these new global regulations and rapid local awakenings, the answer is increasingly becoming no. We're finally taking the necessary steps to ensure that treating our animals doesn't mean we can't treat ourselves. I hope this explainer helped untangle this incredibly vital topic for you. Please take a moment to like, share, and subscribe the channel.